So my topic is a sexual health update and health check. So I've done quite a lot of research, and it's been quite interesting since I was given this topic about 2 months ago, that I've actually become a bit more proactive about talking to my patients about their sexual health life and opening up the conversation. And I will say that my number one message is, please try and talk to your doctor or your nurse or your community health nurse or your family planning clinic and raise any sexual health concerns you might have, because often the doctor won't raise it with you. So why do we need to talk about sexual health? Well, mainly because it's not talked about very much at all. Often women won't even talk about it amongst themselves, or we won't even talk to our partners about it. Sex and sexuality play a very important role in the health of us women across our lifespans, and as our body changes, our sexual health changes as well. It's a really important part of our wellbeing. Okay, so what's important to know? It's really important to know what's normal and healthy, and I want to try and stress that tonight. It's important to know what factors affect our experience of sex and sexuality. We need to know how to express this part of our life in a way that's right for us, in a safe environment, and I just want to stress the domestic violence issue. Contraceptive options need to be looked at, and we need to know about safer sex practices. We need to know about sexually transmitted infections, and we need to know about our vulval health. We don't have time today, unfortunately, to go into lots of different parts of sexuality. We could talk for about 6 hours on that. But libido, pleasure, arousal, and painful sex are all really important topics. And there's 2 fantastic books on sale tonight, both by Rosie King. One is Where Did My Libido Go? And the other one is The Elusive Orgasm, and that's available at the Jean House stand. So the V-bits are not talked about. I don't know many families where they talk about vulvas and vaginas, but it's really important to talk about those 2 V-bits. And when we do an examination at Jean House, we always have a mirror available, and we make women have a look, whether we want them to look because it's normal or we want them to look because it's abnormal, which is even more important. And like the rest of our bodies, these bits do change over time. They change with pregnancy, puberty, they change with menopause. They're always changing. The vulva is the general name for the external part of the female genitalia, and of course we all know what the vagina is. And I just want to stress that irritation isn't normal, and that if you have any pain, itch, burning, ulcers, lumps, bumps, sores, rashes, discharge, you should always check it with your trusted health professional, and never feel too embarrassed to ask a question about your V-bits. All women do have a vaginal discharge. That changes over time as well. And the vagina has its own microbiome, and I think a yogurt and the cultured milk products are fantastic for our vaginas. There's over 40 different lactobacilli that live in the vagina, and it's a very important part of our bodies. It gets unbalanced very easily from hormones, from infections, too many antibiotics. And in my practice, I try and avoid prescribing antibiotics, and I think you should all avoid trying to have antibiotics for colds and flus. It changes with menopause, and it changes with too much hygiene. The Vulva Book is in your show bags. It's a book that I hand out quite regularly when I see my patients, and it's got some fantastic information about how to keep ourselves nice down there. So this is called the Great Wall of Vagina, but it's not actually vaginas, it's actually vulvas. I think this is a fantastic piece of art. It's done by Jamie McCartney in 2015. He's a British artist, and it's actually 400 different, if I can bring that up again. The actual total artwork is 10 lots of 40 panels of different vulvas. The women were aged 18 to 74. And his message is, don't change your parts, change your partner. Because he was actually, and I think that's really important, because having cosmetic surgery to your labia is really like female genital mutilation, unless there's quite a serious biological problem there. And he also wanted to stress that you're normal whatever you look like down there. Another really good source for knowing what it should look like is the Labia Library. So I thank Jamie for that fantastic piece of artwork. I think that's great. So what are sexually transmitted infections? A sexually transmitted infection is anything that you can catch with sex. The commonest one is always chlamydia, and we've got our wheel here, which is the wheel of misfortune. 1 in 5 Australian women will get an STI at some time in their lives, and the highest rate is between 15 and 29 years of age. Chlamydia, gonorrhea and syphilis, STIs in general, are all increasing again. STIs have always been around. During the World Wars, there was a very high incidence of syphilis during the World Wars. There was an increase in STIs in the 60s, in the sexual revolution. And there was a decrease in STIs with the Grim Reaper campaign in the 1980s. And it's actually getting to the stage where we may have to look at a campaign again. So nights like this are really, really important. In Australia recently, there's actually been 2 cases of antibiotic-resistant gonorrhea, so it's actually becoming more difficult to treat. There's been an 80% increase in gonorrhea in Australian women since 2015, and 10 to 15% of those women won't have any symptoms, and gonorrhea is associated with an increased risk of HIV infection as well. Anyone can catch a sexually transmitted infection, and when I was asked to do this talk, the initial topic was talking about the STI in middle-aged women, although young women is still the group where we tend to see the most sexually transmitted infections. There's starting to be an increase in middle-aged women, mainly because they're becoming more sexually active from repartnering, online dating and Tinder and RSVP. And I've had some fantastic conversations with some of my single 40 and 50-year-old patients. One lady was telling me about, I haven't ever looked on RSVP, but she said that you can actually tag three people when you go onto RSVP, so you can theoretically be going out with 3 different people at the same time. Increased overseas travel opens up our risks to more exotic sexually transmitted infections, and most of the gonorrhea infections do come from overseas. Middle-aged women may not be comfortable with the use of condoms. Their older male partners may be reluctant to use a condom because they might have some erectile dysfunction. Our vulvas and vaginas are changing as we get older, and a thinner vagina, which tends to happen with menopause, makes it more fragile but also increases risk of infection. There's also this reluctance for women of all ages to discuss STIs and STI screening with their health professionals and also with their partners. So I'd really like people to think about opening up that conversation. Also, porn websites have led to increased risky sexual practices that may expose people at risk. So who should have a sexual health check? So you should have a sexual health check if you think you might have a sexually transmitted infection or if your partner's had a sexually transmitted infection. And the sort of symptoms that women may complain of is a discharge, either vaginal or anal discharge, vaginal or vulval irritation, a rash, an ulcer, a bump or a lump. You have to think about urinary symptoms because not all burning and frequency from urination is due to a urinary tract infection. Young women particularly should always be screened for chlamydia if they have those symptoms, and herpes can present as that as well. Chlamydia can cause pelvic inflammatory disease, so pelvic pain and uncomfortable sex, and even a reactive arthritis can occur because of a chlamydia infection. If you've had unprotected sex, particularly overseas, and you come back with a general rash or glandular fever-like symptoms, then we do need to start thinking about things like HIV and syphilis. Not all STIs have symptoms, so if you've so you can still have an STI check even if you don't have a symptom. If you've had unsafe sex, either vaginal, oral or anal, if a condom's fallen off, if your partner's had other partners, if you've had other partners, if you've shared needles or for drugs, or if it had tattoos or piercings, particularly done in Asia, you should always have some blood tests done to make sure you haven't picked up hepatitis C or HIV. You can think about having a sexual health check if you're starting a new relationship, and get your partner to have a sexual health check as well. Health resources online are growing all the time, and there's some fantastic resources on the Melbourne Sexual Health Centre website. You can check your risk online. You put in your age, your sexual practices, and it comes up with a printed out sheet that you can take to your doctor or to your nurse, and it explains what your risk may be and what sort of tests you should have. I Spy STI is a sexual health symptom checker, and you can put whether you might have a discharge or a rash or burning and urinary frequency, and put that into your I Spy STI checker. If you have a sexually transmitted infection, it's really important that you notify your partner. You may want to do this anonymously, and there is a website called Let Them Know. It's really important that your partner is treated for their own health, but also because reinfection rates, the chance of them reinfecting you is very high. People get very anxious about what's going to happen at a sexual health check. So therefore it's very important that you see someone that you trust for your sexual health check. Your health professional will ask you some curly questions. They're not just prying into your sex life. They'll be asking you about who your partners have been, how many you've had in the last 12 months, what sort of sex you've had, what sort of protection you've had. And if they're not asking those questions, then you're not seeing the right person. If you don't have any symptoms, it's actually possible. You can do your own. You can do your own swabs or urine test, and you may be sent for a blood test. So your health professional may not even need to do an intimate examination. But if you have symptoms, it's really important that the health professional has a look, and if they don't have a look, go and see someone else. It's a great opportunity to ask questions, to have to talk about contraception, fertility, and maybe any other questions about your general health. So age is not a protection against sexually transmitted infections, but safe sex practices are, and it's fantastic that we've got condoms on the table here. You should use a condom if you're having vaginal or anal sex, and there's flavoured condoms for oral sex, and for women having sex with women, you can get flavoured dams as well. So it's really important to try and use safe sex practices every time you have sex. And you need to remember that STIs are treatable and they're very manageable, and the earlier that they're treated, the better. There's less consequences. The second part of my talk is on health checks, and anyone who knows me or has seen me as a patient knows that I'm a big believer in preventative health. And when I'm not working, I'll be in the pool or running or riding my bike and just generally enjoying life. Usually with a hat and sunglasses on so no one knows who I am. But preventative health is all about having a healthy lifestyle, eating well, sleeping well, exercising, not smoking, and once again trying to limit alcohol. So we know that limiting alcohol is becoming more and more important for health prevention. It's really important to know your family history, because this will help give your health professional a guide as to what screening tests you may need and when they should start. So things like heart disease and diabetes are important, but there's also other inherited diseases like celiac disease or hemochromatosis, and you may need to have some screening tests for those. There's some fantastic online cancer screening tools, and we've got Breast Screen here tonight, and they'll be able to tell you about some of the online breast cancer risk tools. There's also online tools for bowel cancer, and these can be found on the Cancer Victoria website, and the Cancer Australia website is excellent as well. Genetic testing is becoming more common, and there's familial cancer clinics that you can be referred to if it looks like you could be at increased risk because of your family or genetic history. I'm going to talk about cervical screening, breast awareness. Sonia's going to cover heart and bone health tonight. Immunizations, I'm just going to say try and keep up to date all across your lifespan, from baby through to the latest immunisation campaign is for the shingles vaccine for the 70 to 80 age group. And mental and emotional health is incredibly important. I'm not going to talk about that specifically tonight either, but I think it's important that your health professional does ask you every time you go and visit, how are things going? This is just a timeline for health checks across the ages, and most of them start from 50. Heart health checks Sonia's going to talk about. As far as breast checks are concerned, it's very important to be breast aware, know how to self-check your breasts. Mammograms are recommended every 2 years from 50 to 74 years of age, and you can go annually between 40 and 49 and over 74 if you want to. Breast density is something that may be important in the future but isn't reported on yet through breast screen. You need to know your risk for breast cancer, obviously being female, but also our lifestyle, smoking, alcohol, being overweight. Not having children is probably put badly. It's more women that haven't had children or haven't had any pregnancies, and breastfeeding is protective against breast cancer as well. The bowel screening program is going to be rolled out by 2020. It's going to be a 2-year test for everybody between 50 and 74 years of age. You should report any change in bowel habit or any symptoms to your doctor. And once again, screening may start at an early age if you seem to have an increased family risk. Just a quick word on cervical screening. A lot of my patients don't understand about the new cervical screening program. It's started off in December. It's now a test every 5 years. You should attend when your pap smear is due. It's for all sexually active women starting from 25 years of age until the age of 74, and it's a test for HPV or wart virus. The HPV virus causes most cervical cancers, but is also responsible for other cancers, including of the back of the throat. There is also the opportunity for women that haven't had a pap smear for 4 years to do a self-swab, but the woman has to be over the age of 30 and not have attended for a pap smear for the last 4 years. For the under 25 age group, the recommendation is an annual chlamydia test, and obviously an annual check with the doctor to talk about safe sex practices and contraception. So my keys to good health are to try and make time for yourself, try and remain physically active through your whole lifespan, try and eat a good diet, avoid smoking, minimise your alcohol, and as Nellie said, it's really important to be connected. I heard a psychologist talking on the radio recently about the third room. The first room is our homes, the second room is our work, and the third room is wherever we want it to be. It's in rooms like this, it's in sporting clubs, it might be the library, it might be the park. So it's really, really important to avoid loneliness and to stay connected. So I'd like everyone to get into their third room. Thank you.